Good afternoon. I'm George Latimer, Westchester County Executive, and we're happy to be with you here today to deliver a very important message of public health for individuals that want to stay ahead of their health circumstances, do that ounce of prevention that saves us the pound of cure. I'm joined today by our Deputy County Executive, Ken Jenkins, and our Commissioner of Health, Dr. Charlita Amler, along with some professionals from our Department of Health and also from Northwell Health. And we're going to speak today about a very important issue that really affects all of us, and that is the troubling increase in colorectal cancer cases among younger adults. Colorectal cancer has been identified as the second leading cause of cancer death nationwide. Dr. Amler and her colleagues, all medical professionals, are going to share with us some information that we all should take to heart. And as also has been said, a word to the wise should be sufficient. So all of us, myself included, pay close attention because we want to put a spotlight on this issue and discuss the issue of colorectal cancer screening. Medical professionals used to suggest going for screening once you reach age 50. Now experts are recommending that people get screened beginning at age 45 and even earlier if there's a family history of this type of cancer. So we want to highlight this as part of our conversation today, and we hope that whatever information you take, you'll share it with members of your family so that we can stay on the front end of this and make sure that you get the checkups that are necessary. To lead us from this point forward and to introduce the medical professionals who are with us, I give you Dr. Charlita Amler, who's our Commissioner of the Department of Health for Westchester County. Dr. Amler.
Thank you, sir. So thank you, County Executive Latimer, for making time for us to talk about colorectal cancer screening. I know this isn't an easy topic, but it is so very important because screening can identify abnormal growths that can be removed before they become cancerous. And when found early, colorectal cancer is very treatable. Colorectal cancer is the fourth most common of all cancers, and during the past decade, doctors, unfortunately, have been seeing more and more colorectal cancer among younger people. So if you're in your 40s now, it's time to speak to your doctor about your family history, identify your risk factors, and learn how lifestyle changes can reduce your risk. It is also the right time to schedule your screening. If you are at increased risk of colorectal cancer, your doctor may want you to start your screening even earlier than what had previously been recommended. So while some risk factors are beyond our control, such as race and ethnic background, others are associated with lifestyle. It is never too late to adopt a healthier lifestyle. Being overweight and inactive, eating a lot of red meat or processed meat, smoking, and excessive drinking can all increase your risk of colorectal cancer. So it can really help to eat a healthier diet, exercise regularly, and avoid alcohol and tobacco. Last year, the County Health Department joined a continuing collaboration with the cancer support community of Greater New York and Connecticut at Gilda's Club, the American Cancer Society, and the Cancer Support Team to inform county residents about the importance of cancer prevention and early detection. Together, they have given presentations to community groups in English and Spanish about the types of cancer screening available, when to obtain them, and symptoms to watch for. The department has also shared information about county health department programs, such as our health insurance navigators, lead poison prevention, WIC, and our clinical services in Yonkers and White Plains. To eliminate barriers to care, local hospitals and health centers offer registration for free cancer screening to eligible participants on the spot. So that means there's really no excuse not to get this done. I'd like to acknowledge these members of the collaboration who are here today. We have Debbie Vincent, Director of Outreach and Clinical Partnerships, and Samuel Hernandez, a bilingual oncology social worker at the Cancer Support Center of Greater New York and Connecticut at Gilda's Club. We have Dr. Connie Borgenda, Associate Director of the Cancer Center Partnership at the American Cancer Society. We have Tanya Weiss, Executive Director of the Cancer Support Team, and also Marie Roth and Heather McGill from my staff in the Division of Promotion at the County Health Department. None of us want to be concerned about the cost as a barrier. Cost should never be a barrier to screening. And so residents who are uninsured or underinsured can call Cancer Services Program of the Hudson Valley at 914-488-6400 to learn more about these free services for referrals and free cancer screenings throughout Westchester. This number and more information is also available on our website at www.westchestergov.com/health. And now I want to call on Dr. Paul Shukla, who is the Regional Chief of Colon and Rectal Surgery and Professor of Surgery at Westchester at Northwell Health, to share his perspective on this very important topic. Dr. Shukla.
Thank you. Good afternoon. We would like to thank County Executive George Latimer and Health Commissioner Dr. Ambler for inviting us in this news conference. Colorectal cancer, which affects the colon or rectum, is the second leading cause of cancer deaths in our country and the fourth most common cancer. Many may not realize that colorectal cancer is highly preventable. Yet this year, we expect to see over 150,000 people being diagnosed with this cancer in the US. Almost 60% will be diagnosed in late stages, which means that there will be far too many unnecessary deaths. Of these, 4,000 will be under the age of 50. And it's no longer uncommon for us to meet patients in their 30s and tell them you have colorectal cancer. This trend of colorectal cancer under 50 is on the rise. There is a clear link of colorectal cancer to polyps called adenomas. These adenomas can be detected on screening and can be removed, thereby preventing the formation of a cancer. This is why prevention and screening for colorectal cancer is so important. You must understand your risk and when to get screened. If you're an average risk person, you need to have a colonoscopy at the age of 45. If you have a family history of colorectal cancer or advanced polyps, that age is at the age of 40. Therefore, it's important for you to know your family history, and it's also important for people who have had colonoscopies to share their colonoscopy findings with their immediate family, because it does make a difference to your first-degree relatives. Symptoms of colorectal cancer, unfortunately, come in later stages of the disease, but some of the common symptoms could be abdominal pain, blood in your stool, change of bowel habits, consistent diarrhea or constipation, unexplained weight loss. If any of these sound familiar to you, please discuss with your doctor. The different types of screening tests for colorectal cancer include colonoscopy, which is the gold standard, but there are other tests too, like testing the stool for blood, and there are sophisticated stool tests which test for specific DNA of polyps and cancers. The reason why colonoscopy is best is because if a polyp is detected, it can be removed, thereby preventing a cancer from happening. If a stool-based test was positive, you would have to undergo a colonoscopy to remove that polyp or biopsy a cancer. I understand there's been a lot of concern about the prep for colonoscopy, and a lot of patients express their unwillingness to have a colonoscopy because of the prep. All I can tell you is it's not as bad as it sounds. I've had a couple of colonoscopies myself. But what's important to know is you really want to prep well, because only in a well-prepped colon can the doctor identify those small polyps and remove them. Because if the prep is not good, then you might have to repeat one sooner than you want. So it's important that from my personal experience, I tell you that this is not as bad as it sounds, and please get it done. When we look at our county in Westchester, we are doing well in terms of screening, but we can do better. We have certain areas in the county where screening rates are less than the national rate and are similar to the state rate. It's very important for us to focus on the screening rates in the county And along with Dr. Ambler, we want to be the best screened county in the state. So the call to action is, please contact your primary care doctor or your GI physician or the specialist with whom you follow up. We will get you some numbers where you can get screening tests done. Please remember, the most important thing is to get some screening tests done. It's taking that one step, preventing a serious illness from affecting you and your family. Once again, I thank County Executive Latimer and Health Commissioner Dr. Ambler for having us here. And now I would invite Jessica to speak. She has a family history of colon polyps. Jessica?
Just 5 weeks ago, I was beginning prep for my very first routine colonoscopy. Most of my adult life, I had doctors tell me that the appropriate age to begin screening was 50 years old, what we've been hearing. Unless that you had a family history of colon polyps or colon cancer or other risk factors, in which case the age was 45. So I have a family history, as Dr. Shukla mentioned, of colon polyps, and so I thought I was kind of doing really well when I went in a few months before my 45th birthday. Other than the family history, I had very few risk factors. I am a near lifelong vegetarian, now vegan. I'm a non-smoker, non-drinker, fairly physically active. And my two older sisters had gotten their first colonoscopies around the age of 50. So I thought I was being the A+ student. Turns out that I could have benefited from going in a little bit earlier, as we've been hearing from the other speakers. But because I went in when I did, my life was saved. So I'm incredibly grateful for that. So yes, 5 weeks ago, I was diagnosed with colon cancer. A little less than 3 weeks ago, Dr. Shukla operated to remove the mass. And then last week, I'm happy to share, I got what is easily the best news of my entire life, which is that the cancer was early stage because I had gone in early. I need no further treatment outside of the surgery, just ongoing surveillance. So yeah, really, really, really good news there. And one bit of our family history that Dr. Shukla did not share is that I actually have an uncle and a grandmother who died of colon cancer. So until a few weeks ago, in my mind, a diagnosis of colon cancer was really a death sentence. But because of early screening, I feel like I get to heal that trauma within my family, and I also can rewrite the narrative to one where anyone, including myself, can survive and thrive. So because I feel incredibly blessed to have gone in as early as I did, I want to share my story and hope that it encourages anyone who's listening, insured or uninsured, to listen to the recommendations we hear today and to take advantage of the resources that county is providing to get screened early, because it can save your life. I'm proof of that. So, thank you.
Thank you, Jessica. Now I'd like to invite Dr. Jean Gola, who's the Surgeon-in-Chief for Northwell for our region, and he's also the Vice President for the Surgical Services for the Western region of Northwell.
Thank you. And County Executive Latimer, thank you. And Health Commissioner, thank you so much for having us here and for focusing on this topic of colorectal cancer. You can't say this enough times. Colorectal cancer is the second most common disease that's responsible for cancer death in combined men and women. 150,000 cases of colorectal cancer this year in the United States is a lot. Dr. Shukla and I, as you have heard, have a goal, and that is to make Westchester County the best screened county to detect colorectal cancer. And we're doing that not to boast and say we're number one. We're doing that so that we set the standard higher, and hopefully the rest of the state will emulate what we have done here in Westchester County, and the entire state will have a very high rate of screening. Northwell Health, of which Dr. Shukla and I both belong, and it's 2 hospitals in Westchester, Phelps Memorial and Northern Westchester Hospital, and our 40 office locations throughout the state are committed to providing an early detection kit for everyone. So we've set up a number for the public to use, and the public can call, and we can facilitate the screening process and have these home detection kits sent at no cost to the public, and so the screening can be done in that manner. Colorectal cancer is so serious. We like for the public to be aware of the significance of it, and we'd rather not have people waiting until symptoms occur. The goal is to make the diagnosis early with colonoscopy, with these home detection kits that are being made available, and to beat the disease before it becomes much more serious. Thank you.
Thank you very much. Appreciate your remarks. So now it's my pleasure to introduce Debbie Vincent, who is the Director of Outreach and Clinical Partnership for the Cancer Support Community of Greater New York and Connecticut at Gilda's Club.
Thank you, Dr. Amler, and good afternoon, everyone. Cancer Support Community Greater New York and Connecticut at Gilda's Club is a nonprofit organization in White Plains named after the late Saturday Night Live star Gilda Radner that offers free critical services to anyone impacted by cancer. Cancer Support Community's mission is to uplift and strengthen people impacted by cancer by providing support, fostering compassionate communities, and breaking down barriers to care. Cancer Support Community is a founding member of the Cancer Coalition of Westchester, a group of organizations that offer an array of services to support individuals living with cancer, their families, and friends. The coalition's goal is to raise awareness about the wide range of services that are available throughout Westchester County for those impacted by cancer. Cancer Support Community partnered with 2 coalition members, the American Cancer Society and Cancer Support Team, to develop a bilingual educational presentation highlighting the importance of cancer prevention and early detection screening. During the presentation, the group speaks to the incidence of cancer among various demographic groups, the importance of early detection, types of screenings and when to get them, symptoms to be alert to, and the importance of identifying socioeconomic, cultural, and psychosocial barriers that often inhibit people from being attentive to their care. With the support and participation of the Westchester County Department of Health, we have been offering this customizable presentation in a variety of community settings, such as libraries, adult schools, and community partner sites. Local hospitals and health centers are invited to join and offer registrations for free cancer screenings and other resources to eligible participants after the presentation. Our partnership is dedicated to reaching as many people as possible who will benefit from both our educational presentation and sign-ups for free cancer screenings. Organizations that would like to collaborate to host programs or events for community members where free cancer education and screening programs can be delivered are asked to contact the Westchester County Department of Health's Division of Health Promotion at 914-995-5809. Thank you.
So I would especially like to thank Dr. Shukla, Jessica End, Dr. John Gola, Debbie Vincent, my own staff who are here, Renee Recchia who's here, Marie Roth, and Heather McGill, as well as all the partners, the community partners that have joined us here today, and most especially our County Executive, George Latimer, for giving us the platform, and our DCE, for being here in support of us. Thank you, Ken. As you've heard, you can find more information and numbers to call at www.westchestergov.com/health. So please join us in spreading the word to family and friends about colorectal screening. And don't forget to get your own screening done as well, because together we can all save lives. And that's really the main goal of public health. So thank you so very much. And I'm going to turn it back to the county executive. Thank you.
Thank you very much, Dr. Charlene Amler, head of our Department of Health, and for all of the professionals that are here and the people who gave personal testimony. I think Ken and I, as everyday citizens, do not have any particular knowledge of the health system any more than you would as a person watching this. Jessica's story, I think, strikes home to all of us, whatever our age is that there's never a bad time to make sure that we are checking up and making sure that everything is right, and if there is a problem, that it can be found in time. So we have the pleasure of your company with us here today, and we're all very fortunate for that. Thank you all very much for being part of this. We will take this as a clip and circulate it on social media and as well to the public media so that there's an opportunity for people to see this. If you see this at home or you see this on your Facebook page, please share it with someone that you love so that we can have the best possible outcome. We would like to see Westchester at the lead, as the doctor said, of checking and having the screenings and staying ahead of the game. So we're grateful. Thank you again, Dr. Amler, for your leadership. Thank you for watching. George Latimer, Ken Jenkins, we wish you a very good day, and be safe and use the time to protect your health. Have a good day.